Hello, let's talk about hematuria history taking. Hematuria is blood in urine. Okay, so while taking hematuria history, we can use this acronym hematuria. Okay, but before discussing the hematuria history taking, first we will have to note the following differentials, which are the key differentials in the while taking history of hematuria. First is UTI, urinary tract infection, then renal calculi or renal stones. Third is bladder cancer. Fourth, renal cancer. Fifth, prostate disease. Sixth, glomerulonephritis. Seven, trauma or instrumentation. And eight, anticoagulant related bleeding. So, while taking history, hematuria history, we should think about these diagnoses, and we should ask question about these differential to narrow our diagnosis and to rule out the diagnosis differentials. Okay, so we can use this acronym, which is hematuria. So first, in the hematuria history taking, we will ask about hematuria details. And hematuria, in hematuria details, we will be asking about the onset, then we will ask about the color of the blood in the urine. If it is like it can be pink color, red color, tea colored, or cola colored. So if the urine color is cola colored, for example, okay, so cola colored urine will shows us or raises concern for the glomerulonephritis. Okay, glomerular diseases. Okay, so this is important, color is important, onset is also important. Okay, then we'll ask it present in the initial stream of the at the start of the stream of the urine, or is it terminal hematuria, like it only present at the end of the stream, or is it the total hematuria like throughout the stream? Okay, so if there is history of initial hematuria, then it shows us the source urethral source. Okay, and if it is the terminal hematuria, then it will suggest or it shows. Okay, so it will shows us the bladder source or prostate. But if the hematuria is total, meaning that it is present throughout the urinary stream, then it will raises suspicion of the upper tract diseases. Okay, upper tract diseases are maybe the bladder. Okay, so upper tract, upper urinary tract, like bladder, ureter, renal causes. Okay, so it will raise suspicion of the, so we will ask about, and we will also ask about if there is any blood clots present in the uh, uh, hematuria. Okay, so we in the hematuria detail we will ask about these questions to rule out some of the differentials. Okay, so this is about the hematuria details. Next we will ask about the urinary symptoms. So we will next is the E. Explore the associated urinary symptoms. Like we will ask about dysuria, pain while urination, dysuria. We will ask about frequency of urine, frequency. We Also, we will also ask about the urgency. If history is positive for these symptoms, dysuria, frequency, urgency, then it suggests UTI, urinary tract infection. Okay, if this is present, then it will suggest UTI, urinary tract infection. But if there is like weak stream of the urine, if the history suggests weak stream of urine, if there is hesitancy, and if there is nocturia, urine, extreme hesitancy and nocturia, then it will suggest the prostate diseases like BPH, benign prostatic hyperplasia. Then we will also ask in the urinary symptoms, we will also ask about the flank pain, flank or groin pain, flank or groin pain. If there is pattern like flank to groin, flank to groin pain, then it will suggest urethral stones. But if there is only flank pain, then it will suggest renal calculi or renal stones. Okay, so this will suggest renal stones or urethral stones. Sorry, not urethral, ureteric stone, stone in the ureter, ureteric stones. Okay, so these are the differential when asking about the urinary symptoms, right? We will ask about M, pain pattern, hematuria, pain pattern. Okay, so we will ask about the pain pattern, mention pain pattern. Like if we will ask about whether the patient has experiences any pain while passing blood in urine or not. Okay, if there is painful hematuria, there is painful hematuria, then it suggests infections. Okay, it suggests infection or renal stones. Okay, so renal colic, yeah, renal calculi, it will suggest the renal stones. But if there is painless hematuria, painless, no pain while passing blood in urine, then it will raise its concern for malignancy. Okay, there will be suspicion for malignancy. All right, so we will ask about the pain pattern, painful hematuria, renal calculus, painless hematuria, suspicion for malignancy. Okay, then after the M component, then the next is A component, assess red flags and systemic features. After the pain pattern, we will ask about red flags and systemic features. Like if the patient, we will ask about episode or rigors. Okay, so if or rigors or shivering episodes, then it will suggest infection. Then we will ask about any unintentional weight loss and loss of appetite like anorexia. We will ask about weight loss and anorexia. If it is present, then it will raise concern for malignancy, carcinoma. Okay, we will ask about systemic features like edema, We'll ask about joint pain if it is present. If edema is present, like swelling around the eyes, swelling of legs, or any other parts of the body, then it will suggest the glomerular diseases. Okay, glomerular diseases. Okay, so this is the about the red flags. Okay, so the red flags for the hematuria is weight loss and anorexia, while the systemic features like fever, rigors, it will suggest infection, edema, joint pain, glomerular diseases. Okay, like um, glomerulonephritis. Okay, so this is about red flags. Then after the red flags, there will be past medical history. Okay, targeted past medical history or any surgical history, like we will ask about any previous history of stones, history of renal stones, beauty, like Foley's catheterization, we will ask about it, and any previous cancer. So this is targeted history. Here is history of renal stone, then it will help us to narrow our diagnosis. If there is previous or recent history of um, instrumentation like Foley's catheterization, then it will suggest the transient hematuria, transient hematuria. And if there is previous cancer, then it is a red flag for the hematuria. Okay, it is one of the red flag. So we will ask about after the targeted past medical history, ask about useful drug history. In the useful drug history, like we will ask about anticoagulants related bleeding. So we will ask about any anticoagulant drugs. We will ask about NSAID use, because NSAID can cause the renal issues. Okay, it can cause the renal problems. We will ask about like anti cancer agent like cyclophosphamide. Cyclo, why we will ask the about the use of cyclophosphamide, because hemorrhagic cystitis. Okay, so we will ask about the some useful drugs. Okay, so this is about the useful drug history. Then after the useful drug history, we will ask about risk factors, family history, and social history. Like what we will ask about risk factors, like the risk factors for the bladder cancer is smoking. We will ask about smoking, or if the person works in the like a paint industry, so he may be prone to bladder cancer. Okay, so we will ask about smoking history and chemical exposure, because it can cause increases the risk for bladder cancer. Okay, then we will ask about the family history. If there is any positive family history for any like renal diseases, then it can suggest the inherited diseases or cancer risk. Okay, So after that in this we will ask about ideas, concern and expectation of the patient, that what the patient think about this problem, this hematuria, and what he worry the most, and what is his or her expectation from the doctor. Okay, so this is about the, we should think about these diagnoses while taking history from the patient with hematuria.